Hi, this is Dr. Mays with Emergency Teleradiology, and I want to talk to you a little bit today about the terminology that we use when reading chest x-rays. One of the things that's oftentimes a little bit confusing is the word infiltrate. So when we talk about the word infiltrate, we're really talking about any generalized opacification that you see in the lungs. So in general, when you look at something in the lungs, it looks about the same on a chest x-ray, whether it's any one of 5 different categories. So the 5 different things that it could be blood, so if you have someone with vasculitis, it could be pus if you have pneumonia, it could be cells if you have someone with lung cancer, it can be water in such cases like heart failure, or it can also be protein. So any of those things which are in the small airways or the alveoli of the lung are going to cause what's basically an opacification on a chest x-ray. So it's going to look white. And there's different characteristics of the fluffy white pattern that we see, but when it comes down to it, it really can be any one of those 5 things that are causing the opacification, and therefore it becomes really critical to have the clinical history. So some radiologists will use the term infiltrate, and myself personally, when I use the term infiltrate, I'm leaning towards it being an infectious process. If it's a mass or if I think it's a tumor, I will usually call it a tumor, recommend a CT. But if I think it's pneumonia, I will usually call it an infiltrate, and I will recommend a follow-up chest x-ray. The ideal time for doing that follow-up chest x-ray is about 10 to 14 days after the patient has been treated. If you follow up the chest x-ray too late, so if you wait a month, chances are the patient may have been exposed to something again, and they could be having, they could have another infection in their lungs. Likewise, if you follow up too quickly, if you follow up in 2 or 3 days, perhaps the medication hasn't had a chance to really work, we still see an opacification in the lungs, and we still call it an infiltrate, so you think, you're a little bit confused and saying, well, is this really helping the antibiotic that we're giving? So, in general, anything that's white on a chest x-ray is technically an opacity, or it could be called a density, or, as in my case, I tend to call it an infiltrate. So that can mean atelectasis, which is kind of the people that have lungs that aren't fully expanded or something that's causing mass effect. That also technically falls into the classification of infiltrate. And the reality is, at the end of the day, we can use some of the additional findings on that chest x-ray to kind of narrow it down. Specifically, heart failure is probably one we can narrow down pretty well. We look at the azygous vein, we look at the size of the heart, we look to see if there's a pleural effusion. If those things are present, more likely than not, that opacification that we're seeing is related to heart failure. If we see a pleural effusion, we see opacification, but the heart looks okay, and you're telling me that your patient has a cough and a fever, well, then that's probably an infiltrate, or as you guys would call pneumonia. And likewise, if you see someone that has an opacification in their lungs, maybe they have a cough and it looks like they have hyaluronidopathy or fullness in their, their mediastinal lymph nodes, then we certainly have to be worried that that might be a lung cancer or some kind of tumor in the endobronchial system that's causing the opacification. So I'm going to show you a chest x-ray. The one on the right is the sort of control. It's before they had an infiltrate. The one on the left is the one with the infiltrate or the infection, and subsequently the patient was treated and did improve actually clinically, period. So here we go. Again, we're looking at this area right here. There's some lung markings in here and over here. The heart's a little bit large, but for the most part, for an 85-year-old, 90-year-old individual, this is not too far from a baseline exam for them. But then if you look over here, you're starting to see these streaky opacities over here and over here. And this area here is this area here. And so this would be called an infiltrate. So the terminology I would give is a right lower lobe infiltrate, and I would say recommend follow-up exam. And again, when I'm talking about the follow-up, I'm recommending a follow-up in about 10 to 14 days. Not a month, not 3 days. Somewhere in that 10 to 14 day range would work ideally for you. So just in summary here, the main thing that I wanted to kind of get across to you guys is when we say infiltrate, more often than not, we mean infection, we mean pneumonia. That terminology is a little bit of a gray area. Some physicians don't like to use that term at all. Some radiologists think that it's pretty nondescript. but it's no more nondescript than opacity or density, which is kind of all the same thing. You really have to have some clinical information, though, to guide the final diagnosis. So if we have the ability to say cough and fever, I can tell you it's going to be an infectious infiltrate. Now, we'll usually put the word infectious in there. If I think it's heart failure, I will usually just call it heart failure. But if I'm not sure, or I can't really tell, I may just put infiltrate. And so that puts a little bit of the reliance on the clinical picture in terms of what's going on with the patient. So hopefully this helps clear up a little bit about what the term infiltrate means. And again, the follow-up time frame that we like to see chest x-rays followed up is about 10 to 14 days. Thank you. This is Dr. Mays with Emergency Teleradiology. Have a good day.